Abdomen. Inspect the skin, noting color, vascularity, striae, or stretch marks due to past stretching of the reticular skin layers, due to past or prolonged stretching, and then scars. So you will ask about the source of the scar and use a ruler by centimeter to measure the scar's length. On lesions, so wear gloves to inspect lesions, if any. So abdominal skin may be paler than the general skin tone because this is so seldom exposed to the natural elements. And then next, inspect the umbilicus, noting color, location, and contour. So, umbilical skin tones are similar to surrounding abdominal skin tones or even pinkish. And umbilicus is midline at lateral line. And it is recessed or inverted or protruding no more than 0.5 centimeter and is round or conical. And then next, inspect the contour of the abdomen. Sitting at the client's side, look across the abdomen and slightly higher than the client's abdomen. So, abdomen is flat, rounded or scaphoid, and abdomen should be evenly rounded. Then next is you will inspect the symmetry of the abdomen. So you look at the abdomen as the client lies in a relaxed supine position. So the abdomen should be symmetric. And then inspect abdominal movement, noting respiratory movement, aortic pulsations, and or peristaltic waves. So abdominal respiratory movement may be seen especially in male clients. And a slight pulsation of the abdominal aorta, which is visible in the epigastrium, extend full length in thin people. Auscultate for bowel sound, so use the diaphragm of the stethoscope and make sure that it is warm before you place it on the client's abdomen. Then apply light pressure or simply rest the stethoscope on a tender abdomen. So begin in the right lower quadrant and proceed clockwise, covering all quadrants. So the right lower quadrants, right upper, right left upper, left lower. Listen for at least 5 minutes before determining that there is no vowel sounds are present and that the vowel sounds are silent, noting intensity, pitch, and frequency. So a series of intermittent soft clicks and gurgles are heard at a rate of 5 to 30 per minute. And then next, auscultate for vascular sound. So use the bell of the stethoscope to listen for bruits over the abdominal aorta and renal iliac and femoral arteries. So bruits are normally heard over the abdominal aorta or renal, iliac, or femoral arteries. And there should be no friction rub over the liver or spleen is present. Percuss the abdomen for tone, lightly and systematically percuss all 4 quadrants. Generalized tympani predominates over the abdomen because of air in the stomach and intestines. So dullness is heard over the liver and spleen. And then next, percuss the liver. Percuss the span of height of the liver by determining its lower and upper borders. Begin the liver percussion in the right lower quadrant. And percuss upward toward the chest. The lower border of the liver dullness is located at the costal margin to 1 to 2 cm below. And then next is percuss the spleen. Percuss the spleen. Begin posterior to the left, mid-axillary line, and percuss downward, noting the change from lung resonance to splenic dullness. The spleen is an oval area of dullness approximately 7 cm wide near the left pant rib and slightly posterior to the mid-axillary line. And then next is perform blunt percussion on the liver and the kidneys. So this is to assess for tenderness and difficult to palpate structures. Percuss the liver by placing your left hand and flat against the lower right anterior rib cage. Use the ulnar side of your right face to stroke your left hand. So normally, there should be no tenderness. And then perform light palpation, noting tenderness or guarding in all quadrants. So light palpation is used to identify areas of tenderness and muscular resistance. Using the fingertips, begin palpation in an untender quadrant and compress the depth of 1 cm in a dipping motion. And then gently lift the fingers and move to the next area. Abdomen is non-tender and soft, so there is no guarding. And then next is perform deep palpation, noting tenderness or masses in all quadrants to delineate abdominal organs and detect subtle masses. Using the palmar surface of the fingers, compress to a maximum depth, perform bimanual palpation if you encounter resistance or to access deeper structures. Normal tenderness is possible over the xiphoid process and then the aorta, cecum, sigmoid colon, and ovaries with deep palpation. And then next is palpate the umbilicus and surrounding area for swelling, bulges, or mass. Umbilicus and surrounding areas are free of swellings, bulges, or mass. Then palpate the aorta. Use your thumb and first finger or use two hands to palpate deeply in the epigastrium, slightly to the left of the midline. Assess the pulsation of the abdominal aorta. So the aorta is approximately 2.5 centimeter or 3 centimeter wide with a moderately strong and regular pulse. Possibly mild tenderness may be elicited. And then palpate the liver, noting consistency and tenderness. So to palpate by manually, stand at the client's right side and place your hand to palpate. Palpate the urinary bladder. Palpate for a distended bladder when the client's history or other findings warrant. Example is dull percussion noted over the symphysis pubis. So begin at the symphysis pubis and move upward and outward to estimate the bladder border. So an empty bladder is neither palpable nor tender.